Age is the single most important factor which determines the fertility potential of a woman. Its impact on the fertility potential of a man is much lesser. As women wait longer to have children, either due to studies or due to career or due to whatever reason, their egg quantity and quality decrease, and they find it increasingly difficult to become pregnant, to maintain a normal pregnancy, and to have a healthy baby. In this video, let's see what exactly happens to the egg quantity and quality with increasing age. Hello everyone, welcome back to Mind Body Tonic, and this is Dr. Sita with you again. About a month ago, a couple came to me for consultation. Both the man and the woman were in their early 30s. They had been married for 2 years or so. They have got wonderful opportunities in the Middle East and they wanted to postpone pregnancy for another couple of years. I tried to advise them regarding the risks of postponing a first pregnancy, especially as the woman is already in her 30s. But she was very casual about it. She told me, "Come on doctor, so many women even at the age of 45 they deliver. If at all I find it difficult to become pregnant, then I will resort to technologies like IVF, etc." I was taken aback and I felt very sad too. This woman and many women like her who have got so much knowledge about so many worldly things, they don't know what they are doing to themselves and to their eggs. They take their eggs for granted. I was reminded of a saying by the American Society of Reproductive Medicine, which says, as women delay childbearing, there is an unrealistic expectation that technology can reverse the effects of aging. Sadly, technology cannot reverse the effects of aging on fertility. Let's have a quick look at the general trend of the relationship between fertility and age. Generally, fertility is maximum in the 20s. In the early 30s, there is a slow decline of fertility, and after 35, the decline is more rapid. After 40, the decline is even more rapid, and after 45, very few women are fertile. After the age of 40 years, the incidence of miscarriage also increases. After the age of 40 years, the success rate with IVF and other assisted reproductive techniques also decrease a lot. This is just a general trend. There are very many women in their 20s who have got significant issues with their eggs, and there are some women in their 40s also who have no problem in becoming pregnant and delivering a healthy baby. Now let's see what happens to the quantity of eggs as age increases. The eggs or oocytes are contained within structures called primordial follicles. These primordial follicles or non-growing follicles account for about 90 to 95% of the follicles at any given time in the life of a female. These start appearing when the female fetus is 5 months old, and at that time they are about 6 to 7 million in number. Right from this time, they start decreasing in number by a process of atresia which occurs at a constant rate. At birth, the number of follicles is reduced from 6 to 7 million to about 1 to 2 million. And these are the follicles which the woman is destined to have during her entire life. More follicles won't be produced at any time later, unlike sperms which are being produced constantly. The process of atresia continues throughout childhood. At the time of puberty, only 3 lakhs to 4 lakhs follicles remain. Of these, only 300 to 400 will be ovulated during a woman's reproductive life from menarche to menopause, and the remainder undergo atresia. After menopause is attained, there will be no follicles in the ovary, and the ovary itself starts shrinking. Now let's see what happens to the quality of eggs as age increases. An important change in the egg quality with age is the frequency of genetic abnormalities. This happens mostly because as a woman ages, the egg nucleus often divides abnormally, distributing unequal amount of genetic material, and will have either less or more number of chromosomes instead of the proper 23 chromosomes. When these eggs get fertilized, the defect gets transferred to the embryo also. Example is Down syndrome, a condition that results when the embryo has got one extra chromosome 21. I am sure most of you must have heard about it. However, thankfully, most embryos formed thus either fail to implant properly or undergo early miscarriage. Now that you know how age affects fertility, what can be a possible plan of action? Those of you in your late 20s, please don't postpone pregnancy for whatever reason. Those of you in your early 30s, it's not too late for you yet. It's time to make some quick decisions and act upon them. And if you're not getting quick results, it's better to consult an infertility specialist. Those of you in your late 30s, well, what has happened. No point in regretting about it. Make an appointment with an infertility specialist at the earliest. Those of you in your early 40s, don't lose hope. Your eggs might have aged, but not your uterus. Donor eggs might be an option for you. Please share this knowledge with others too. Those of you who have not yet subscribed to the channel, please do subscribe now and click the bell icon too. See you soon with another video. Till then, take care of yourselves and your loved ones and stay blessed.